Welcome to this update segment where we're going to be looking at Europe and starting off with the United Kingdom. Now, just before we start, I've just learned something really quite incredible. Apparently, the contact tracing app is using 0300 numbers. So when the contact tracers ring using the 0300 numbers, a lot of people have got it blocked because the 0300 numbers, as you know if you're in the UK, is normally a cold calling number. And many of us block it because we don't want anyone to say, I hear you've recently been involved in an accident that wasn't your fault. So we block those numbers, we block them. And that's the number that they're using. So that's really quite incredible. Who's in charge of this program that they could make such an elementary mistake and not yet have corrected it? And as well as that, we've got no contact tracing app. So many countries around the world have, but in the UK, we haven't managed that. Scotland hasn't got one, Northern Ireland, Wales, England, none of us have got a contact tracing app. Quite incredible that these simple things are not in place and that mistakes of such an elementary nature are made. And again, there just seems to be so little accountability as a result of the grave errors that are made by these people in charge of these programs. Now, going on to the rolling lockdown situation in the UK. So we know that there was a lockdown in Leicester last month. Then it was the turn of Manchester, North Yorkshire, parts of Lancashire, that contiguous area where there was increased restrictions imposed. So far, in both of those areas, they do seem to be working. Now the same situation has been applied to Aberdeen in Scotland, and Preston in England could be the next one to have a legal lockdown. But the really encouraging thing about Preston is that the local authorities have taken the initiative, just as they did in Liverpool. And this is really encouraging. This localisation of the healthcare response is very, very encouraging, and we need much more of this, and there's been very little of it. Again, an indictment of local administrators and local healthcare authorities in the UK that so little of this has been done proactively locally. They've kind of waited for this heavy top-down approach from government. But Liverpool, a good exception, and Preston now looks like a good exception. So let's look at what's happening in Preston, because this is a model really for the rest of the world and the rest of the country. They've identified the drivers of transmission. So what they're saying is, in Preston, most transmission is in the household and in the community, particularly one household visiting another household, as it was in the Manchester, Lancashire, North Yorkshire area. Same modality of transmission. So the authorities there are advising to avoid home visits, obviously. One family should not be visiting another family in Preston at this time, just as the same in that area in Manchester, North Yorkshire, Lancashire, where it's legally enforced. In Preston, it's advisory. And let's hope this works and it saves the need for legal enforcement. Chief Executive Adrian Phillips, we are not waiting for some government announcement. Isn't that just great to hear? We're actually taking some initiative. I'm an executive. I'm going to take an initiative. Wow. Thank you, Mr. Phillips. Well done. We're not waiting for some government announcement, as other areas have. We know our rates are increasing, and they have increased over the last few weeks to a level where we are concerned that we could face government intervention. So let's act before that. Obviously. We've been working with our communities to make sure we get key messages out. Didn't we just look at the importance of this in the Bolivian situation, where because of the multilingual nature of the society in Bolivia, key messages often weren't given. Mr. Phillips is advising people to wear face coverings at all times. I agree with him. And get tested even with mild symptoms. And of course, we completely agree. So this is a very good local initiative, just like was taken in Liverpool. A statement on the authorities' website said evidence from Public Health England. So Public Health England have said there's a spike of coronavirus cases in Preston, and the majority of the spread is through community, household and community. So that's where we can target things. So here we've got a double targeting. We've got targeting as long as people comply with this, and if it's fully explained to them over and over again. We've looked at evidence on these videos that if things are well explained to people and they understand, the vast majority of people will comply in most situations, in most countries with that. So we know it's localised to the Preston area in North Lancashire. We know it's localised to that area, and we know that the transmission is localised to the household community situation. So again, we'll target that. Specific targeting. Good to see. Similar situation in Aberdeen in Scotland. Population of Scotland is probably about 6 million now. The figures are all out of date for the UK because we haven't had a census for 9 years. So the last census it was 5.5 million. Now Aberdeen, up on the north east coast of Scotland, of course, you probably heard of it in context. If you don't live in the UK, you probably heard of it in context of the North Sea oil industry. 54 cases in recent days, and an additional 54 cases. And these are community driven in most cases. So community transmission is occurring. No doubt about it. Pubs and restaurants have been closed. Visitors ordered to stay away. Now these orders come from the Scottish Government, so it's legally enforceable. And no household visits. So here we see the situation is exactly the same as the situation that is advised in Preston and the situation that was mandated in Manchester, North Lancashire, North Yorkshire. So the same response being applied to the same problem in different parts of the country on a localised, regionalised basis. And of course we appeal to all the people in these areas to comply with this. We don't want a Bolivia type situation in the UK. Now going on to the other countries in Europe, here we see, for example, this is the linear scale. So Spain has got way more new cases. Then France, the United Kingdom, Germany, Italy, all picking up somewhat. So these are that's the situation in those European countries. Now, just to give you the context here, I'm using the linear graphs at the moment, so there's a linear scale here. And of course, we know all of these people had huge numbers of cases. We also notice that this is adjusted per capita. So they are the adjusted figures per capita. Increasing in several European countries, including the UK, but particularly in Spain. And we did notice yesterday there's a lot of clusters, well over 500 clusters identified in Spain. So do you want to call this a second wave? Do you want to call it a continuation of the first? It doesn't matter. The point is we've got increasing cases in Europe now, which is a concern and something we need to get on top of at this relatively early stage. And we looked at precise figures for the number of people that are infected from the Office for National Statistics just a few days ago on this video. So Spain itself, new cases in the last 24 hours, 1,772 new cases, one new death. But of course, because the cases are increasing, as we see the cases are increasing here, you don't see it there because I've got the wrong screen on. There we go. Because we see the cases are increasing here, the deaths will follow, albeit with the lag that we expect. But given that these increasing cases in Spain, unfortunately, it's inevitable there will be some increases in deaths because of the lag effect that we are now familiar with. So concerning trends in Spain, and this will increase over the next weeks and month or so. France, again, quite a significant increase in cases, another 1,695 cases in a 24-hour period. This is quite a large amount. Now, hospitalisations have actually gone down. That should be minus 14. And ITU have gone down. So again, we see the situation where cases are going up, but hospitalisations are going down. And this is because the hospitalisations and the ITU cases are based on people that got infected maybe last month because of this delay effect. But we can say with some degree of confidence, unfortunately, that because there's 1,695 new cases in a 24-hour period in France, that in the next 2, 3, 4 weeks, this will feed through into more hospitalisations and more intensive care patients in France. That is unfortunately inevitable given the current state of this viral spread. So again, 24 hours, 14 less hospital patients, 14 less ITU patients, 9 more deaths, but a great increase in cases that is going to feed through, unfortunately. Now, Turkey. Over 900 cases a day for the past 4 weeks, so that's increasing. Last 24 hours, 1,178 new cases officially diagnosed in Turkey. We know the real numbers are always way higher. That's the number of deaths. Now, so we've got 1,178 new cases per 24 hours now. Back in March, it was 5,000 new cases a day. So we see the situation now in Turkey is nothing like as bad as it was in March in terms of increasing new cases, but the restrictions in Turkey that have been lifted means that the cases are now going to increase, and there's clearly the risk that we could go back to the situation we were in March. That is a risk. And that's reflected by the health minister in Turkey. Health minister, we're concerned about the increase in the number of cases, previously limited to some provinces, spreading in the coming days throughout the country. So this is spreading throughout the country, not just in the cities anymore. And just before we finish, we will see an area of particular concern. Now, Ankara Medical Chamber. So this is the medical association in Ankara, the capital, of course. Now, what they're saying here is the Ankara Medical Chamber, pandemic hospitals and their intensive care units in Ankara are 100% full. Right, so the hospitals designated for pandemic care and their intensive care units are 100% full in Ankara. And the Ankara Medical Chamber is saying they're unable to take new COVID-19 patients, reminiscent of the appalling situation in the last video in Bolivia. So hospitals full, ITUs full, you turn up, you can't get care. It's just an appalling situation. Unless, of course, you want to believe the Ankara Provincial Medical Health Directorate, who say that intensive cares are 63% full. Pandemic remains under control. Well, they both cannot be right, can they? Now, I don't really see why the government officials should be lying about this. But unfortunately, we have known that governments have been less than accurate in the past. Why they would want to do that, I don't know. I guess it shows, if there's low cases, it shows the government's doing really well and the government's not doing really well from that data. Ankara Medical Chamber, I can't see why they would lie either, but the data is clearly inconsistent. I think I'll accept that data as being more likely to be accurate. You can make your own decision. So it looks like in Ankara the hospitals and intensive care units are full. That means people will start dying through lack of simple interventions, as they did in Bolivia, unfortunately. Let's hope the Ankara Provincial Health Directorate is accurate, but as I say, make up your own mind. Now, in Turkey, southeast areas, I don't know these areas, I'm not going to attempt to pronounce them, but these are in the southeast of Turkey. Now, this, of course, is the part of Turkey that borders with Syria, Iran, and Iraq. And we know there's been many cases in Iran. Iraq has got increasing cases as well. And Syria is just not able to cope with the cases that it's got adequately. So it does seem to be a bit of an area there in southeast Turkey spreading into Syria, Iran and Iraq, which of course is concerning. Obviously, we couldn't finish today's videos. If you believe in positive thoughts, have positive thoughts. If you believe in prayer, pray for the appalling situation. I'm sure everyone's seen the videos now of the explosions in Beirut. Was it 3,750 tons of ammonium nitrate exploded? Unbelievable. Well over 100 people killed. I think the official rate's about 137 last time I checked. Thousands and thousands of people injured. 300,000 people essentially homeless in the Beirut area because of this massive explosion from the docks. Lebanon already struggling with COVID-19, with more cases than that, because we know the infrastructure is very poor. Lebanon has got massive economic difficulties, to put it mildly. And the other thing that it couldn't have been worse was this ammonium nitrate was stored next to about 50% of the country's food supply, and it blew it up. So that is going to be a problem in the days and weeks to come. Let's hope international aid is there to help. Encouraging to see that Israeli, Egyptian and Jordanian medical authorities intervening to help the injured and the difficulty in Lebanon. Other international aid on its way. But they're going to need things as simple as grain in Lebanon, unfortunately, because that was blown up. Unbelievable that it happened, but it's not my job to do the post-mortem on it now. It happened, and we just extend our thoughts to the people of Lebanon at this time. So, as always, thank you for watching that update.